Project is on rotator cuff tears. So the picture on the left shows what a normal rotator cuff should look like, while the picture on the right shows a rotator cuff with problems. So as you can see, the tendons are both torn and inflamed. So the most important thing to know about this injury is that it normally does happen over time, and this is due to muscle deterioration, wear and tear, repetition of the same arm movement over time, um, such as like sports that include overhead movement like tennis or baseball, pitching or catching above the head. However, you should know that it can also happen suddenly if you fall on the arm or if you lift something extremely heavy. But for the most part, it does happen over time. Okay, so the shoulder is very important to just about any activity that requires the use of the upper extremity, and the rotator cuff is made up of four muscles and their tendons. So this group of muscles includes the teres minor, supraspinatus, infraspinatus, and subscapularis. The picture on the right doesn't show the subscapularis because it is on the anterior side of the body. This picture is from the posterior. Most commonly, the tear is involved within the supraspinatus tendon, and research shows that 13% of rotator cuff tears are strictly just in this tendon alone. So that's really important to know. For the mechanisms of injury, normally this injury is due to either degenerative changes or injury, basically. So the muscle will deteriorate or with repetitive stress. It also will show degenerative changes. But for injury, it can happen with severe traumatic accidents or falling on an outstretched hand. Also, it can be seen with shoulder dislocation. Some secondary mechanisms include aging, smoking, and thyroid pathologies, which are all risk factors for a rotator cuff tear. Here we have a video.
A little bit too much celebration. Watch right here. I never understand these, but that one jacked up his shoulder. You won't see it right there, but you'll see it as he comes down. He won't do the second one, and he turns around, and then he heads down and winces. And it's his right shoulder. Hopefully nothing is major. Rolling his shoulder around, yeah. I'm telling you, it popped out. That's what he's saying.
Okay, so here we have a professional baseball player that just was celebrating with one of his teammates and I guess hit his shoulder too hard. I'm assuming that this was a shoulder dislocation, and if it is, he is now at risk at in the future having rotator cuff problems.
A little bit too much celebration. Watch right here. I never understand.
So when should one go see a doctor? The number one symptom of a rotator cuff tear would be shoulder pain, but patients also experience weakness in the shoulder, trouble raising their arm, unable to lift things they normally would be able to lift, a clicking or popping sound of the shoulder, and shoulder stiffness. So diagnosis is based on history. That's the first thing that the doctor would assess, and then after that they do a clinical examination by assessing different strength tests and rotator cuff tests and range of motion. And then after that, the doctor will give an x-ray or MRI or ultrasound, just because this injury looks so similar to tendonitis or bursitis. So this is why they they get the x-rays done to differentiate the injuries. Also, they may perform a IMPT, which is the isokinetic muscle performance test, and that is to estimate the functional status of the rotator cuff muscles. So normally people go the non-surgical route when treating a rotator cuff tear, and for this they just have a lot of rest, modify their activity, have pain relieving medication like NSAIDs. They will sometimes have steroid injections and also go to a physical therapist, complete different muscle strengthening exercises. There's 3 different surgical options. There's open repair, arthroscopic repair, which is the most common and least invasive method, and the mini open repair. And then here are my references.